Hi, this is Catie Harris, and this is an episode of the NursePreneurs Podcast. Today we have Dr. Jordan Romano on with us. Dr. Romano, thank you so much for being here with us.
My pleasure. Thanks for having me.
Yeah, absolutely. So, in the beginning of these podcast interviews, I'd love to get to know people. So tell us a little bit about yourself and we'll work up to where you are now and what you're doing.
Perfect. I'm a internal medicine trained physician. I trained at Dartmouth Hitchcock Medical Center for my internal medicine residency. After that, I worked there for a couple of years in the hospital as a hospitalist, and I've been in Boston at Massachusetts General Hospital for the past 13 years.
Okay. And you're still practicing medicine?
Certainly am, yeah.
Okay. And then you also do this medical expert witness consultations, correct?
That's right. I've been a medical expert witness for about a decade now.
How did you get into that?
Yeah, it was serendipity. One of my colleagues one day looked a little stressed, and I asked him what was going on. And he asked me how long I had been out of residency, and I said, about 5 years. And he said, you can help me. And he took me out to lunch the following day and just introduced me to the medical expert witness consulting world.
Okay. Was he in the middle of a case, or was he being sued, or?
No. Frequently what happens is it's sort of like Noah's Ark, two at a time. In the medical expert witness space, you'll not hear anything for many weeks, if not a month at a time. And then out of the blue, you'll have a few people reach out to you, lawyers, to retain you in a matter. And so sometimes your schedule can't handle, it happens quite frequently, that you can't handle the volume that comes in. And that's what had happened to my colleague. So he passed the case over to me.
Okay. And what did you think of your first case?
It was exciting. It was different. And it was the medicine that I'd been trained to do, but just in a different format. And so I think after being a physician in the medical world, seeing it overlaid into the legal world was unique and something that I wanted to learn more about.
Did you, as an internist, feel while you were going through that case, all of a sudden almost exposed in a way, like, hey, maybe I haven't been documenting as well as I should be, or did that case illuminate anything for you?
I mean, doing this work for sure, and most expert witnesses will tell me this when I work with them, it will make you a better clinician. Mm-hmm. And I wouldn't say it makes you more nervous. It just shows you the ways that things can go sideways. And just for clarification, just because something untoward happened in the hospital does not mean that there was medical malpractice. We're retained to comment on what's called the standard of care. Mm-hmm. What would a reasonably prudent physician do in same or similar circumstances? That's the legal lens that we would look through the medical care with. But when something untoward happens, or you're just reading case after case as to how things can go sideways in a hospital, or how untoward events happen, it will no doubt raise your radar so that when you're practicing, you will be a better clinician, hands down.
Do you have an example of that?
Well, I think there are just lots of general buckets that these cases fall into, whether it's delayed diagnosis, failure to follow up on medical imaging, whether it's communication among staff members, thin documentation. There's any number of scenarios that can unfold. And I think, one area too is, and I always pass this on to the residents when I'm on the teaching service, is that you need to remain curious. I think there is a lot of heuristics or mental biases that happen. One of them is for sure is what I would call premature closure. So you're the emergency room doctor, you tell me about a patient that's coming into the hospital, you tell me the diagnosis, and I stop thinking. I just say, yes, everything you said is plausible, and let's just continue with that treatment. And you sort of ignore data that runs counter to the thesis that was proposed by the diagnosis that was proposed by the earlier clinicians. And so you have to remain skeptical and curious and continue to evaluate the patients to prove yourself wrong, if you will.
Yeah, and that's really great advice because I feel like there is that kind of group medical think where we all, a diagnosis is given and we all just kind of go along with it until somebody stops and says, hey, maybe this isn't fitting anymore. We're like trying to force all these pieces in. So did you have training per se, or was it kind of like on the job training to become a medical expert witness?
I would say it was a little of both. Many years ago, I did go to a couple courses, and a lot of that was taught by lawyers. And it was, to me, a good intro level understanding of this space, something that they don't teach in medical school. So that's, and then on top of that, I would say it was just by doing the reps. I self-taught. I've had some lawyer mentors, but I haven't had any physician mentors along the way. And that's why I wanted to look, I'm a physician, I'm an educator, and we learn through the apprenticeship model. Mm-hmm. We have interns below us as attendings. There's a residency where there are different ranks, if you will. And I apply that to the medical expert witness mentoring that I do, because I think it's essential for individuals to improve, to seek out that level of mentorship consistently and constantly.
Okay. Okay. So can you walk us through the role of an expert witness in, let's say, medical malpractice case? Like, what does that process kind of look like?
Sure. So something untoward has happened. There's an individual who may want to file suit. They've brought that to the attention of a lawyer. The medical expert witness is found. Maybe they have an advertisement. Maybe it's by word of mouth that they're found. And keep in mind, there are two sides to the legal process. There's the defense, who is defending the physicians, and then there's the plaintiffs who represent the aggrieved, or the person that feels that something happened that should not have happened the way it happened. They need physicians to explain what a reasonable, prudent physician would have done in same or similar circumstances. So there are defense firms reaching out to experts to say, hey, can you look at this case and tell me, did Dr. So-and-so do what he or she was supposed to do? And the plaintiffs are reaching out saying, did they not do something, or should they have done something but didn't do it, and in a certain time frame, if you will. And so there's two sets of experts that are retained in every case to look at the case from a different perspective.
Okay. Are you normally on one side or the other, or does it depend on the case?
What I would say is I'm not on any side. I'm retained to look at the case. Depending on who contacts me, usually you may have a brief conversation. And typically what I'll say is, if what you're telling me is borne out in the records, I may think that X, Y, and Z are decent next steps. So typically what happens is, if they feel like you're a good match for the case, meaning you're the expert they need, they'll send you the records. You'll review the records and then have a conversation. Depending on the jurisdiction, depending on the laws and when I say jurisdiction, it's the state that this lawsuit is happening, there may or may not be a report that needs to be generated. And then after that, there's something called the discovery process, where they're collecting more information about the case. They're taking sworn statements of individuals, and they may take your sworn statement as a medical expert witness, and that's called a deposition. So that's an open book interrogation, if you will, where you'll sit from anywhere from an hour to 4 or 5 hours answering questions, where the opposing counsel is asking you questions about your education, your training, your experience, and then about the specific case and the facts of the case. It's an open book interrogation, so you can have records there with you to discuss the case with them. And then, depending on the legal process, can move forward. If both sides can't mediate a resolution, it could be set for trial, and then you may be asked to testify in court.
So are there times where you're starting to get into a case and you're going through this stuff, and then you realize, it's outside the standard of care, and do you have to drop the case at that point, or how do you navigate that situation?
By communicating openly. I've been doing this long enough, and this is certainly something that I advise individuals that I mentor, is that you need to have an open dialogue with retaining counsel. Mm-hmm. A lot of people would like to think that these cases are black and white. Some of them are. The vast majority of them are in the gray. The vast majority of them, you learn more as the case goes on. And during that discovery process, when you hear from the doctors who were there, when you hear from the nurses that were there, when you hear from the patients, when you get all of the medical records and you've gone through everything, the story becomes more clear. And there are times, as you point out, where you may be retained by a certain side, and it is an uncomfortable conversation, but you have to tell them, hey, look, this is not playing out the way I thought it would. And if I'm deposed, these are some, what I would say are wrinkles in the case. I thought X, Y, and Z was going to play out like X, Y, and Z, but it's actually showing that what they did was reasonable or what they did wasn't reasonable. I would say, as you're more skilled, you can anticipate those things, just like a clinician can anticipate the course of your pneumonia when you're admitted to the hospital. Same with these cases. You can kind of, you know, within a certain degree of error that more likely than not, it's not going to just, things will proceed in a natural way and not, something will not just come out of left field to completely derail things. And lawyers are pretty good. They don't want to waste their time nor their money or their clients' money. They want to provide you with enough information so that there are no surprises, if you will. Now, sometimes there are, but for the most part, they want to get as much information to you up front so that when you're evaluating the case, you can anticipate what's to come.
Okay, so it's not like a Law and Order case where you have a surprise witness that comes out of the blue in the middle of the courtroom or something and derails the whole case.
No, certainly not. Certainly not. No.
All right. So when you first started doing the expert witness, when you first went in for your first case, let's say, for a cross-examination, how was that experience? Were you nervous about it?
I didn't know enough to be nervous. And I think that if I could do it again, I wish I had a mentor like myself to help me through the process. It is not something natural that we do in medicine. It's not something we're taught in medical school or in residency. And so the more experience you have in it and the more preparation you do for it, the better, just like anything else, the better you'll become at it. I didn't know enough. And I was really, it's sort of like running a marathon without training. Hey, it's just, I'm running this distance. It's not a big deal. But until you experience it, you really just don't know what you're in for.
Yeah, I recently had that I was asked to be a medical expert witness on a case, and they took me into court, and I was like terrified. Like I felt like I was the one being sued. I'm like, oh my God, I don't want to lose this case. But it was somewhat intimidating. So I can appreciate that. And yeah, I also wish that I had done more for that case, because it was, I felt like I knew my stuff. And then when they start interrogating on the other side, it's kind of like, oh, yeah, I should have thought that through. But so when you are analyzing some of these more complex medical cases, I mean, how do you even start with something? And where do you find really the time to do this? I mean, you just talked about interviewing people. Are you actually doing that? And how do you find the time to do that?
Well, I review the records that are sent to me by retaining counsel. I would say I do it. Everybody finds kind of time when I'm off service or nights. I enjoy doing this in the evenings after everybody in my family is asleep. I tend to be late to bed and early to rise, so I can fit it in then. And it's just it's like reading. To me, it's like an interesting puzzle to sort out. So I enjoy sifting through everything and trying to picture what happened. I have a framework that I do it. Where am I? When was it? Who are the players? Looking at the cadence and the chronology, if you will, as to how things unfolded. And then retaining counsel sometimes will have very specific questions for you. So that, it's not like sometimes they're like, tell me everything about the case. Is there something here? But other times they have very specific questions. I'm retaining you to comment on provider Dr. Smith. Look at his care on the 7th and 8th, if you would, please. Okay. That's very prescriptive. Now, is it always like that? No. But sometimes it is.
Okay. And so what are some of the common misconceptions, I guess, that you've learned about medical malpractice from doing this?
And misconceptions from whose perspective?
I would say from healthcare professionals.
Yeah, I mean, I would say that it is acting as a medical expert witness for sure is something that's essential to the process, and not participating does not mean that the process isn't happening. For too long, this has been something that has been occurring kind of in an opaque manner. And, I appreciate you having me on, and having conversations like this is, to me, I think, essential to the process, because I want to bring more physicians into the medical malpractice space. The legal system needs physicians who are skilled in this arena to help explain the medicine. And I want those individuals that are participating to be as skilled as possible so that it's efficient for everyone involved. And pretending that this isn't happening, that this process isn't going on, certainly doesn't help anyone. Now, obviously, if you're not comfortable doing this, you shouldn't be feel obligated or forced to do this. But the more people that participate in this, I think the better for everyone involved.
Yeah. Yeah. And we have a kind of a parallel too with the legal nurse consultants, and they help out, quite a bit with the nursing care and that standard of care. So we definitely can appreciate that as well, because there's a big need for that as well. So are you actively mentoring physicians at this time in this in the expert witness space?
Yeah, I've been doing it for a number of years.
Okay. And what kind of physicians do you find? Is there like a special type or a stereotype almost of the type of physician that would be interested in something like this?
No, I would say over time, there's just been more and more clinicians that are interested. Certainly since the pandemic, the number has increased. I think that the fact that this is another way to leverage your skill set as a clinician, whether that, or a provider, whether that, like, as you pointed out, whether you're a nurse or a nurse practitioner or physician's assistant, or a physician, this is another way that you can leverage that skill set. And so a lot of people are curious about it. The people I tend to work with, I do work with individuals who are new. I would say 80+% of the individuals that I work with have done a case or two. They typically tell me they enjoy the work after they've done it. They also tell me that they've been told that they're good at it and they want more work, but they're not sure how to do it. And they may have actually even invested in themselves, whether that's a course or some advertising, but they may or may not have gotten the results that they were looking for. And so I work with them to not only get them more cases, but make sure that when they get those cases, that they are performing in a way that is to their highest capability, and to make sure that the legal system can operate with them efficiently as well.
Okay. And do you have like a course or something, or do you see some of your residents come in and you're like, you'd be perfect for this, and start mentoring them, or how does that work?
Residents typically don't act as medical expert witnesses, but in terms of individuals that I mentor, I can usually tell who's going to be successful. They're individuals who want to be engaged. I've had a course in the past, but typically the individuals that do the best, I do one-on-one mentoring with. And right now, for the past few years, what I've done is I have an agency. And so basically it's a matchmaking agency. I'll help you get cases. And in addition, I have some other services that I provide for you. What I found is many clinicians are just very busy. And so I found that if I actually do the business aspect of it for them, help get you the cases, process any of the funds, work on all the communications, that just help. Most doctors just want to do the work. They're really not interested in all the other business aspect of things that have to go through with this.
Right. And that's amazing, because that is the hardest part. And that was the next thing I was going to ask you, is like, how do you find these cases? Because we've had, nurses go through all kinds of legal courses and stuff, and it's always the same problem at the end. Like, how do I get in front of the lawyer? How do I then let them know? So how did you start finding your cases? And now I mean, I imagine you have a reputation now that you can rely on, but how did you find those initial cases?
Yeah, I would say it's a fantastic question. And the other thing too is the first thing I would say is you have to play a long enough game. I think a lot of people are like, I want more cases now. And and I hear it a lot. I see it on social media a lot. I like the analogy of a restaurant. You've opened up a restaurant, you think your food's pretty good, and you're like, I want lots of customers. Yes. And what I say sometimes is be careful what you wish for, because if you get too many customers and your food isn't as good as you think, that really could sink your reputation. Mm-hmm. And you don't want to get in a deposition and not perform well. And I don't mean perform well just from a nuts and bolts perspective, meaning you don't even know the rules of the game, if you will. Mm-hmm. And so be careful what you wish for. I think it's reasonable to want more cases, because the way you do improve at doing this is by doing the work. But you don't want so much work that you're just what I call collecting retainers. If you're just taking cases, maybe you're taking some marginal cases that you shouldn't be commenting on. All of those sorts of things will ultimately submarine your efforts at building a name for yourself and building a reputation for being a solid operator in this space and a solid consultant. So I would say my work came slowly at first, and then quickly. Yeah, I needed to get reps in just like anybody else. And then, in another podcast, I talk about the first time I testified in court. And when that was finished, there was a decision I found out about 6 months later that the side I was retained by the plaintiffs, and this was in a Maryland case. All of a sudden, I started getting all these defense cases in Maryland, and I went back and looked and found out that there was a large decision for the plaintiffs, the side that I was testifying on behalf in that case. And to this day, even in the past few weeks, I received a few cases from defense firms in Maryland, which is a small jurisdiction. So doing a good job can have ripple effects for many, many years. That was several years ago. Mm-hmm. And I'm still getting cases based on that, being seen in that venue at that time. And so that's why I say I'm glad that if you want more cases, that's fantastic. But do not discount that you need to do a really good job on the work that you're doing. And some of that may be admitting that maybe you're not as good as you think you are. I seek out mentorship still to this day. Mm-hmm. I speak to lawyers to learn from them. I'll learn from individuals like yourself. I'm always seeking out ways to improve, because I realize it just takes one positive interaction to really have ripple effects for many years and decades to come. And that's what I would encourage individuals, is that I'm glad you're eager to get cases. I'm glad that you're willing to engage and learn and take a course to perhaps learn more. But as more and more people are coming into this space, there are more and more individuals saying, where can I get cases? And that can be for sure can be challenging.
Right. And then, I mean, I would suppose too, since you're handing them these cases in your mentorship, right? So your reputation is on the line as well, right? To give these cases to people?
Not necessarily. I do refer people what you'll learn as you do this work is that cases come in from a lot of different ways. You could have referrals. You can have direct advertising, whether that's just on a website or direct email advertising or communication through social media. People may learn of me through podcasts like this. And so, or from doing the work. When you do a deposition, there's opposing counsel that's seeing you. When you're in a courtroom, there's opposing counsel that sees you operate, and they may call you. I was testifying earlier this year in Georgia, and when I landed at home and the case had, I believe, settled at that point, a couple attorneys from the opposing side had reached out to me and said, "Hey, we'd like to retain you in a couple matters." And so what I would say is, cases can come from lots of different avenues, and that's something to pay attention to. I actually forget your original question, so I want to make sure I answered it.
I can't remember. I have to rewind.
Fair enough.
So for the agency, tell me a little bit about the agency, because I'm looking at your website and it looks like you do a lot of stuff. I mean, how do you find the time to put all this stuff together, first of all? Yeah, go ahead.
It's about a team. So I've built a fantastic team that helps me with this. And now I'm remembering some of your question and circling back to it. My agency is unique in that I help build your practice. It's not about me and my reputation. It's about you and helping you build your reputation. And so the marketing efforts that I take when you engage with me is not building up medicalexpertwitness.com. It's about building up your personal brand and investing with me time and effort so that within a couple of years, you are self-sustaining and you can go off on your own. My best mentees, I would love to always get them business, but the best sign of success for myself and my agency and my firm is when I have an expert that says, you know what, I'm ready to go off on my own. And again, what happens then is those individuals, without a doubt, are pleased and will send people to me and say, you know what, even though you're in the same specialty as me and having more, in this particular case, nephrologists in this space is not helpful for me because it means maybe I won't get as many cases. You need to go to Jordan because he's going to help you get started and get off on the right foot. And so that's what my agency does. It's not about just keeping you as part of the tribe. There are individuals that stay with me and I run their business and they just say, you know what, get me cases, keep me busy, do all the back office stuff. That's great. But there are other individuals who it's a prescribed period. It's 18, 24, 36 months. And once they get to a certain size and the flywheel gets going, they say, you know what, Jordan, it's been great, but I can do this on my own now. And I think my reputation is at a place where I'll get enough work on my own.
So now do you work with nurses if nurses wanted to contact you?
I would love to. I speak with nurses all the time. I have a cadre of legal nurse consultants that I'm always in communication with. I love hiring them as well and putting them in touch with my lawyer network that I'm frequently chatting with. So I work with everybody, physicians, assistants, nurse practitioners, physicians, legal nurse consultants. Absolutely.
Okay, so you have that Done With You accelerator program, which is a one-on-one, and that's the maybe 18, 24, 36-month program that you're talking about. And then you have a Done For You virtual office, and that's when they've kind of graduated and they're on their own.
Yeah, those are most of those are legacy products. Most of what I'm doing now is some of that is bespoke mentorship. So there are individuals who within my agency will pick one of those where they say, you know what, I actually want you just to run everything for me. And that's an offer that I will give about a third of the individuals in my agency.
Oh, that sounds very appealing. Can you run everything for me in my life? Because that would be wonderful.
I'd be happy to. And that's the other cool thing that I do is I offer virtual assistants as well. So these virtual assistants are US based. They handle all the communication with the lawyers. I mean, if you want to, if there's a lead and we pass it on to you and you're like, I've got it from here, that's great. But if you're just busy and want to just give us a link to your calendar, we can do everything for you.
Oh, that's amazing. All right. Well, so for the nurses that are out there listening to this that are dying to learn more, where can they find you? How do they get in touch with you?
Yeah, if you go to medicalexpertwitness.com, you'll be able to set up 30 minutes to chat with me. I'd love to hear your story, hear what you're working on, and learn from you. Definitely go to medicalexpertwitness.com, click up, find a time that works for you, and I look forward to chatting with you.
All right, Dr. Romano, thank you so much for speaking with us today.
My pleasure. Thanks for having me.